Hello everyone. So welcome everyone for EFoF Sheikh's session, and this is our second session. Mr. Raj Singh and I started this EFoF. EFoF means Essex Family of Families, and then another like a baby was born out of it called Sheikhs, which is the sharing knowledge, experience, and skills. This is our second session, and behind the scenes, Dr. Suresh is helping me. Today's session is on diabetes, diet, and lifestyle modifications. A quick intro about the speaker. I said quick intro, but it can't be quick if I tell completely. But first of all, I would like to tell he is Dr. Suresh Ponnusamy. His clinical experience, he has got vast clinical experience in various specialties in general medicine, including diabetes, which is his special interest. And if you are looking at the qualifications, yes, we all know undergraduation is MBBS. On top of that, he has done MD General Medicine and then MRCP UK, and he has done Diploma in Diabetology. Regarding the teaching experience, so he worked in Malaysia before coming to UK. In the Malaysia, he was an associate professor in AIMST University, one of the most reputed universities in Malaysia. He has done publications, journals and posters. He has written 2 medical books. So whatnot, it's an extensive list, and it will be a separate session if I tell each and everything. So I'm going to stop here. The one important thing about me, that's Ramesh and Dr. Suresh, belong to the same college and belong to the same batch. So now I proudly invite the speaker, Dr. Suresh, to give us a talk on diabetes, diet and lifestyle modifications. Over to you, Dr. Suresh.
Thank you, Ramesh. Thanks for the nice and kind introduction. Good evening, all. This is the second session in EFoF Sheikh's session. Actually, it's a great initiative by Dr. Ramesh and Raj Singh. The main topics which I'm going to cover under this session is, first of all, diabetes. I don't want to tell many things about this, but what controls the diabetes? Mainly, if you want to have a healthy life with diabetes, you have to think about 2 main things. The first one is risk factors, knowing about diabetes, especially the risk factors, and then how to control those risk factors. Among those risk factors, the most prominent one or the most toughest one is the diet. The next one is physical activity. And there are many other things which you have to be consistent in maintaining a healthy lifestyle. So diet is the cornerstone or the center message for my topic. The other lifestyle modifications, I will tell about physical activity and many things else in the order of preference. So let us go into the risk factors first. We are going to focus on type 2 diabetes mainly because that is prevalent in 90% of the population. So type 1, I'm not touching in this session. Type 2, if you take type 2, it is mainly centered around obesity. So it can be taken, the dietary management, the lifestyle modification can also be taken for obesity management as well. So obesity predisposed to this type 2 diabetes, which you all know. So one of the most prominent is, as I mentioned before, is the diet, then sedentary lifestyle. And obesity here, I mean BMI, body mass index more than 25. Then stress, hypertension, and smoking. So this spectrum, if you look at this spectrum, this half, they are all modifiable risk factors. The other side of the spectrum is non-modifiable risk factors, such as ethnicity, age, gestational diabetes, family history, and genetics. So these are all non-modifiable risk factors, which we can't do anything. We are born with that. The genes, there are many genes controlling that. There are hundreds of genes which determine that a patient may develop obesity, and on following that, he may become a diabetic, a type 2 diabetic. So not everybody is prone to diabetes unless there is a genetic factor, and also later on environmental factor on top of that genetic factor plays a big role. So we should not ignore this genetic and family history, but that is non-modifiable. So I will just concentrate on the modifiable ones, which we have many roles for us to play as a patient or as a healthcare practitioner. So what are the things which we have to concentrate on lifestyle modification? What are the components? If you take Diabetes UK, in March 2008, they have published evidence-based nutrition guidelines for prevention and management of diabetes. So what they have told is weight loss management is the main thing. If you want to prevent onset of diabetes in a high-risk population, such as Asian population or Indian, we are prone to that. We are obesogenic. We are born in an obesogenic environment, rice-eating population. So the central obesity is the main triggering factor for becoming a diabetic, type 2 diabetic. So what we have to do is, first we have to concentrate on weight loss management, whether it is a Caucasian or an Asian population, doesn't matter. The next one is dietary strategies. There are many different dietary strategies, which I'm going to highlight later. The third one is dietary patterns and specific foods, which I will be telling in detail. And the fourth one is physical activity. So what are the things which are going to be affecting us in these components? Let us see in the next slide. There is one study done in United States, and it has been published in JAMA Internal Medicine. It shows over the period of from last 20 years, I can say from 1990 to 2010, maybe 10 years, I can say. So there is an increasing trend in the consumption of trans fatty acids. So this graph shows that increased consumption of trans fatty acids. What do you mean by trans fatty acids? So trans fatty acids, mainly I can give you some examples like margarines, cakes, donuts, pastries, ice cream, breads, and fast food items, French fries, all those things, they are categorized as, they contain trans fatty acids more. And they are in the top of the list in the consumption by the public. So it has been increasing from 1999 to 2010, and that study has shown that. The second one is PFOS, polyunsaturated fatty acids, which comprises of nuts, seeds, and fatty fish. And the third one is red or processed meat. So that is the third in the list which are consumed by the population. And the fourth one, which is very, very useful and healthy, is whole grain, fresh fruits and vegetables. And these are least consumed by the population. And that's why there is increased incidence of obesity and type 2 diabetes in the last 10 to 20 years. And this study has proven that why we became more prone to diabetes. Next, we will concentrate on the calorie consumption. There are two things we have to take. The first is how much we take, how much we eat in terms of calories, then how much we burn after eating the calories. So what are the causes which can cause increased calorie intake? That determines that is determined by high content of the quality of the food, maybe the calorie content of the food. Meals outside, taken outside home, like most of the people nowadays, they don't prefer to cook in the home. They go outside, and there's a lot of eateries, restaurants open outside, and a lot of attractive food items displayed by the food markets, of course, for their business benefit. And they advertise very well. The food industry is growing up very well, and that invites or attracts the population, and they go outside to eat. And of course, sometimes they tend to overeat when they work for a long period, especially in the night duties. Though you have increased in the calorie intake, but the problem is there is no problem in increased intake of calories, but if you don't burn out the calories, whatever you taken in, then the problem of obesity and type 2 diabetes comes in. So the present trend is, that a lot of maybe we can say like 30 to 40 years before, maybe 1970s or 80s, there is no the people tend to use less cars. They tend to go out to work in cycles or sometimes walk. Maybe 1970s, 60s, they don't tend to use much of cars. So they burn whatever they eat, doesn't matter, but they do burn their calories, and they have a very high healthy work lifestyle. But nowadays, after the advent of many technology like computers, IT, working lifestyle, long working hours in the night time, and of course they can do everything online. So that leads to a sedentary lifestyle. And of course they tend to work for a long period, even in the maybe sometimes 16 hours in a day. So these are all leads to a less of calorie burning, and that causes increased calorie consumption. So it eventually leads to an imbalance in total calorie consumed, as you all know from this. People living with diabetes should aim to eat a healthy diet, but also need to be aware of how their diet and lifestyle choices. It's all choice. Sometimes if you tell them that I have a choice to eat or not to eat, or I can choose whatever food I can eat, but they are not aware of what what food choices they have picked up and how it will impact their blood glucose levels. They are not aware about that. The first and primary step in control of obesity and diabetes is the education, patient education. They should be known to be aware of what are the food choices they have made over the years, or daily, you can say, like that can impact their blood glucose levels. And when we are talking about food choices, there are two different types of food in terms of mentioning about the glycemic index. What do you mean by glycemic index? Glycemic index is the measure of, sometimes some foods, it will increase the glucose levels. When you're taken in, it will increase the glucose levels to slightly. Some will increase moderately. Some will quickly increase the blood glucose sharply, maybe to a higher peak. So they are categorized as low glycemic index, which steadily or gradually increases the blood glucose after eating. Those foods which increases the glucose level to a higher peak very quickly, they are called foods of high glycemic index. So let us see in one study here. The study was done in American Journal of Clinical Nutrition, where they have found out the effects of dietary glycemic index on brain regions when it is related to reward and craving in men. That study concluded with suggestions to limit the consumption of highly processed carbohydrates such as white bread, white rice, white potato. This and also products with concentrated sugars. These high glycemic foods such as white bread, white rice, white potato, and concentrated sugar, sometimes potato fries, French fries, and all those things, donuts, they all are high glycemic foods. And what they do is they will steeply rise the blood sugar very quickly, and it will cause steep fall in the blood sugar after a few hours, maybe within two hours. If they eat at 8 o'clock, by 10 o'clock, there will be a steady fall in the blood glucose, and they will develop hunger. So that is a main disadvantage for high glycemic foods when you are eating that. So it causes craving in men, and that will cause that will drive them to eat further food. By 10:30, 11 o'clock, they'll be craving with hunger, and they'll go and eat another high glycemic food. So that's how it determines that it is not healthy in that case, and determines the hyperglycemia at many peaks during the day. European Diabetes Prevention Study, EDIPS, that study has told that every kg lost is associated, every kg of weight lost is associated with a 16% relative reduction in risk of type 2 diabetes. And even 10% loss may be sufficient to reduce the risk of future diabetes by 80%. So you don't have to do too much of weight loss reduction. Just 5% reduction in your weight can prevent the type 2 diabetes by 50%. 1 in 2 patients or 2 persons will never develop type 2 diabetes because of sudden weight loss of 5%, maybe in 3 months' time, not quickly. So, and there is this European study has proven that even 5% weight loss maintained at 3 years follow-up, it can reduce by the incidence of type 2 diabetes by 89%, almost 90%, which is a very, it shows the consistency of maintaining the weight loss over 3 years. So the next thing is weight loss in diabetic. When you talk about overweight diabetic patients or obese type 2 diabetic patients, you can even remit if they're already a diabetic patient. You can aim for remission, type 2 diabetes remission. You don't have to take any tablets. With only weight loss of 15 kg quickly, maybe within 2 months or 3 months, 15 kg of weight loss can induce type 2 diabetes remission. You can become diabetic free within that 3 or 4 months. And what is the other advantage of weight loss in those by doing like 15 kg weight loss is it will reduce the cardiovascular disease risk. So in that case, you have to aim for that weight loss by reducing the calorie intake and also increasing the energy expenditure by physical activity. The other dietary strategies which are recommended by Diabetes UK is prudent diet, healthy eating pattern. It includes energy restriction, that's calorie restriction to induce that whatever 5 to 7% weight loss. So maybe 850 kilocalories per day or 850 to 1000, we can say. And how do you approach that? How do you gain that weight loss? How do you go across for that? By modifying the diet. How to modify the diet? By moderate total fat intake, which should be less than 35% of total energy, and reduced saturated fat intake, which should be less than 10% of total energy, and increased dietary fiber intake, which should be more than 15 kg. So increase the fiber content and moderate the total fat content and reduce the saturated fat content, and also increase physical activity, which I mean physical activity here, I mean 30 minutes per day, daily, and or 150 minutes per week exercise. So there are a lot of apps available nowadays which can calculate calories burned and how long you have been active throughout the day. There are a lot of apps nowadays, so you don't have to worry about too much on calorie burning out. The next one is plate method. You need to concentrate on this slide very, very well, because the plate method is an easy way to remember the technique of meal planning. It recommends a healthy distribution of carbohydrate, a lower fat intake, and a greater amount of fruits and vegetables. So in this plate, you can see that it is divided into 3 different portions. Actually, 50% of the eating plate should be of vegetables and non-starchy vegetables, and 25% of that should be a plate with starch or bread, and another 25% should be a protein, a lean protein, such as one fish or one chicken piece. So if you, and sometimes you can also add yogurt and some fruits also is very, very important, like one apple. They all contribute to a balanced diet. And these are all advisable in a patient who is already a type 2 diabetic or who is obese. So you need to maintain the consistency for a longer time, and that will bring out a big change. So again, with Diabetes UK, it has shown as evidence from prospective cohort studies that diets with high fat, high glycemic index, and low fiber dietary patterns, they are associated with increased diabetes risk. And conversely, plant-based diets, vegetarian, vegan diets, they are associated with reduced risk of diabetes and increased healthy eating scores. Over 4 years, it also reduced the risk of diabetes. So what are the foods with inverse association? Like if you consume these foods, there is less incidence of diabetes and obesity. What are those? Whole grain products, increased fruit and vegetable intake. And fruits, many people ask like which fruits I should eat. These are apples, recommended ones in a already established diabetes patients I'm talking. Blueberries, grapes, and sometimes pomegranate, and green leafy vegetables, fermented dairy products such as yogurt and cheese. So these foods have got an inverse association with the diabetes risk. There are some foods which with little or no association in terms of diabetes risk, like eggs, nuts, fish. They don't have increased risk. You are advised to, or you are recommended to consume these foods. Of course, not in very high quantity, maybe in moderate quantity. And foods with adverse effect, which are not recommended or which should be taken into caution, increased risk of diabetes, include processed meat or red meat, potatoes in any form, like French fries or in any form of potatoes. They are high glycemic, sugar sweetened beverages and sugar sweetened foods, refined carbohydrates like white bread, white rice. So brown rice is advisable rather than the white rice. And then increased alcohol consumption. Increased alcohol consumption has got a U-shaped association with diabetes, where if you take acute alcohol, even if you take binge drinking of alcohol, there will be a fall in the blood sugar. And if you take daily increased amounts of alcohol, there will be a chronic raise in the blood sugar level. So that's why they say that there should be restricted or a moderate alcohol consumption is advised, or less than that. So you should eat these foods with caution. Glycemic index, which again I wanted to stress on this, it's a rating system, as I mentioned, for foods containing carbohydrates. It means if a food raises blood glucose levels very quickly or moderately or slowly, which I told you, it's a rating system for defining different carbohydrate foods. It tells us whether it quickly or moderate or slowly raises blood sugar values. A rating system, as I mentioned here, it runs from GI index of food. Every food runs from 0 to 100. And we categorize them as 3 categories, like low GI, moderate GI, and high GI index foods. So low GI is any food which can have a value of less than 55, and 56 to 69 is moderate glycemic index, and high glycemic index values is more than 70%. So what are those foods which are having low GI? You can find out in the slide, a lot of list here. So there are many other things you can find out, like white bread. In the starch variety, you can see that white bread, oatmeal, taco shells, whereas rice bran has got less glycemic index. Vegetables, you can say that cooked carrots has got high glycemic index. Fruits, watermelon has got high, grapefruit has got low GI, dairy products, low fat yogurt has got low, whereas ice cream has got high GI, and proteins, peanuts has got low GI, whereas pinto beans, chickpeas, black-eyed beans has got high GI. So you should be aware about this. And of course, nowadays, all the foods are marketed with the calorie value. So you don't have to worry about that. So in diabetics, it is highly recommended to take food with low glycemic index, which is less than 55.